So you talked about some amazing opportunities that students can get involved with, but what are some good resources to learn more, either about learning more about these opportunities or just learning more about abortion access in general?
Yeah, so our website, NARAL Pro-Choice Maryland, is a great place to go, especially if you're looking for policy information. So we're really involved in legislative work here in Maryland. So if you want to keep up to date on what's going on with legislative session, which is wrapping up today, check out our website. Our website also has a really great directory of all of the abortion providers here in Maryland. So if you yourself are trying to figure out where to access abortion care, or if someone that you love is trying to figure out where to access abortion care here in Maryland, that's a great place to go. We have cost information for a lot of those clinics. And so it's a great place to check out and try and figure out like, where's the closest clinic? How much might it cost for me to seek care there? Guttmacher Institute is an awesome organization that does really great research work. And they do research both nationally and internationally. That's where a lot of the statistics that I've talked about today are from. They're really amazing for if you want to do any more research about this information. You're going to find a lot of the stuff that you're looking for on their website. And if you're interested in, global work around abortion access, they're another really awesome resource. And then the Center for Reproductive Rights. So they're a group of advocates and lawyers who do work around human rights, especially focused on sexual and reproductive health care and rights and abortion access internationally and here in the US. And they're a great place to look for like state policy information. So if you're trying to figure out like, what does policy look like in my home state? What will it look like if Roe v. Wade is no longer the law of the land? They have a really helpful map for trying to figure out what that would look like. It's scary, but it's not a bad thing to think about if this is something you care about, to kind of get a sense of like, what does state law look like? Where will abortion care still be accessible? And Center for Reproductive Rights, I think, has one of the best resources for figuring that out. And they're also a great place to look for, if you're looking for information about international law around abortion care, or if you're trying to figure out state law around abortion care. The National Network of Abortion Funds. So they are a great resource for finding local abortion funds. So for example, if you want to volunteer with your abortion fund in your home state, check out the National Network of Abortion Funds. They have it listed by state. If you have a friend who is trying to access abortion care and needs help paying for it, check out the National Network of Abortion Funds, find out where their local abortion fund is, give them a call. Hopefully they can help. They do awesome work, so I definitely encourage you to follow them also on social media. Repro Action is an awesome organization that does national and local work to advance access to abortion care and also to kind of spread the word about reproductive justice. They host really cool webinars, usually about once a month, around various reproductive justice topics. So definitely encourage you to get on their listserv. They're really interesting. A lot of their webinars are super fun, really informative. And then finally, Repro Jobs. If this isn't a space that you're interested in working in, Repro Jobs is like the place to go. Their social media is awesome, really helpful, lots of great updates on the movement. They post tons of jobs. So definitely encourage you to get on their newsletter and follow them on social media, because you can learn a ton about what's going on in the movement even before you're job hunting. And then also once you are job hunting, they're, I think, the best resource for figuring out who's hiring. So yeah, I think that's all of our slides. But I'm curious, I don't know if any questions have popped up for any of the folks from Sex Week as I've been talking. Or if not, we can go ahead and wrap up. But
I did have one question. Can you go into how the landscape has changed, if at all, during COVID times?
Yeah, that's a great question. So COVID has definitely impacted care. So we were Maryland, it was a Maryland judge who ruled that medication abortion could be provided via telemedicine. So from July through January, clinics around the country were starting to provide medication abortion via telemedicine. So prior to that, legally, you had to come to the clinic to get handed your medication. You couldn't go to a pharmacy to get it the way you could get any other medication, even though the same medications that you're being handed at the clinic are prescribed at a pharmacy for other causes. But unfortunately, the prescribing requirements for medication abortion require you to go to the clinic to get given the medication. So it was a Maryland federal judge that, because of COVID, said, now you can do medication abortion via telemedicine. So that was really awesome because folks were no longer having to drive to the clinic and figure out who could get them there to be handed these pills and given, given the information that they could have gotten, over the phone, via Zoom, via other teleconferencing software. And it was saving folks a lot of time. But unfortunately then in January, the Supreme Court decided to reinstate the prescribing requirements and make it so that folks had to go back to going to the clinic. So that was one kind of positive change, but short-lived change that came about as a result of COVID. Clinics have had to change the way that they operate because of COVID, because obviously they're trying to minimize the number of folks who are in waiting rooms. So there's a lot more of having folks hang out in their cars while they're, the people that they're driving are in the clinic. There's a lot more folks like hanging out in the car, filling out paperwork, that kind of stuff. Clinics are, doing a lot of the same things you see any other healthcare provider doing, like doing symptom checks when folks come in to make sure that, people are coming in and are healthy. Some clinics did have to shut down initially when COVID started to try and figure out what their procedures were going to look like as a result of COVID. So it definitely required some reconfiguring and some juggling. Maryland was lucky because we didn't see as much of a shutdown as some other states did. Unfortunately, there were some states where we saw political maneuvering to try and shut down access to abortion care entirely as a result of COVID. So in Texas, for example, people were not able to access abortion care for, I believe, 2 to 3 weeks because the governor used it as a reason to claim that abortion care is not essential care and to say that abortion clinics were not able to operate. Abortion clinics are not operating on a massive margin. Losing 2 to 3 weeks of funding can be really harmful to an abortion clinic's bottom line. They are businesses, they still have to pay their staff. And then keeping in mind that they're, an abortion procedure is a time-sensitive thing. For some folks, those couple of weeks was enough for them to have to go out of state to seek care. They were no longer able to seek care in their home state. And that becomes a much more complicated thing. So thankfully here in Maryland, we didn't see as much of an impact. I have heard from providers that they are seeing more folks who are later along in their pregnancy, in part because people, I think, are putting off accessing care because of concerns about being in a medical space because of COVID. I hear that more from folks out of state than I do from folks here. So there's definitely been an impact. I think we've been luckier here in Maryland than in states where people tried to use it as an excuse to try and shut down care. But yeah, there was definitely an impact, and I think people are looking forward to hopefully being able to put things back to the way that they were. Did any other questions pop up for folks while I was chatting?
I do have a quick question real quick. So you talked a lot about barriers and gave a lot of amazing information about barriers that may exist, but what about some additional barriers that could exist for LGBTQ plus people who are trying to get an abortion?
Yeah, that's a great point. So we don't have great data on the experiences of LGBTQ plus folks who are trying to access care. Guttmacher tried to collect data on it, and this is the one place where I'm going to say Guttmacher didn't do a great job, because I think that the questionnaire, because they're using data collected from clinics, and so folks are not necessarily putting down their sexual orientation when they're at an abortion clinic, understandably. And so what they reported was that I think 95 or 96% of folks were straight. I think that's pretty unlikely. I think it's probably, there were a lot more bisexual and pansexual folks who were there. I think they were probably missing some non-binary folks and potentially some trans folks who were there. So unfortunately, we don't have great data on the experiences and the access issues that LGBTQ plus folks face when they're trying to access care. Anecdotally, we know that there's definitely some challenges because a lot of these spaces are still coded as women's spaces, right? They're still talked about as like women's healthcare spaces. And so people may put off seeking care because they don't want to deal with gender dysphoria as a result of being in a women's healthcare space. Gender dysphoria as a result of like being a pregnant person and being viewed as a pregnant person. And that can definitely cause people to not want to access care. We don't have as much information about the impact of abortion care when you're potentially like a bisexual or pansexual woman, and what that would look like. We do see more folks talking about it if they are, for example, non-binary, and talking about being in a space that is like coded as a women's healthcare space and the impact that it has on them. It's something I hope that we see more data come out about. I hope that folks are designing studies around this. I hope that folks are doing work around this. It's definitely something I've heard a lot of conversation about over the last few years. So I'm really hoping that we start to see more come out about this. But I know that it's a conversation that's happening. And I know that it's definitely a challenge that a lot of folks face when they're trying to figure out where to access care, and trying to find a place that's not going to cause as much gender dysphoria for them.
Thank you so much for answering that. Does anyone else have any other questions before we kind of wrap up? Awesome. Well, Erin, do you have any last concluding remarks for this webinar today, or any few things that you would like to say to the audience before we wrap up here?
I just want to say, if anybody who's watching has themselves had an abortion or has a loved one who's had an abortion, I want you to know that that is okay, and you shouldn't listen to the people who you hear talking about it not being okay. There's a study called the Turnaway Study that looked at people's experiences around abortion access and the results of that. So they looked at, they kind of compared the long-term results of folks who had had access to abortion care to people who had tried to seek abortion care and were not able to get it. And what they found is that 5 years later, 95% of people who had accessed abortion care still felt good about that decision. And I think that's such an important takeaway, because the culture is out here trying to tell us that you should feel ashamed if you have had an abortion. But the reality is most people don't. Most people leave their abortion experience feeling relieved, feeling good, feeling like they made the choice that was right for them. And so I just want to affirm that that is okay, and that you should not listen to kind of the broader cultural narrative that accessing abortion should be this really fraught, shameful, stigmatizing experience if that was not your experience of it. Because it is totally fine if you have had an abortion or someone you loved had an abortion and they came out of there feeling great. That is totally fine. Or if they came out of there feeling like it wasn't a big deal, that's also totally fine. I just want to affirm that however you feel about your own experience is the way that it is, and that there is support out there for you. So definitely encourage you to check out the Turnaway Study if this is something you're interested in. For me, it was really awesome to look at, and to affirm that despite the cultural messaging that we get around abortion care, most people who access abortion still feel good about that decision, still feel like they made the right choice for them, and still feel like, they wouldn't change what they did. So it's totally normal to feel that way if that's how you feel.
Yeah, thank you so much for that. I know that definitely means a lot to a lot of people. But thank you for all of this amazing information that you have shared with Sex Week today, and we will be sharing with the rest of the UMD community. We really value your time and NARAL's time as well. And we are so lucky that you have taken the time out of your day to be here with us. So if people want to contact you or contact NARAL, we will put emails in descriptions of this video, and we also have a pamphlet of a lot of the different resources that Erin was referring to, where people can directly go to the resource and click the name, which takes you to the link of the resource. So again, thank you so much, Erin.
Yeah, thank you all for having me. This was awesome.